In today's video, we're going to be talking about vitiligo, which is a very common pigmentary disorder which can affect 1% of the population. It's slightly more common in women with darker skin, however it can affect any gender, any age, any location, or any race. Usually symptoms develop before the age of 20, and then there's a progressive depigmentation over time. But ultimately the result and cause of the disease is a loss of melanocytes, which causes this disfigurement, sun sensitivity, and psychosocial distress. The pathogenesis of vitiligo is unknown, but several mechanisms have been proposed, which includes genetic abnormalities, autoimmunity, dysregulation of redox, which is reduction and oxidation, and it's also been said that maybe some biochemical and neural pathways are involved, which all accumulate to the endpoint of melanocyte destruction. Vitiligo is considered to be an autoimmune disease because it's usually associated with other autoimmune disorders, including autoimmune hypothyroidism, pernicious anemia, Addison's disease, and systemic lupus erythematosus. There's also elevated levels of autoantibodies, which aren't only directed at melanocytes but also to other end organs, which include the thyroid, the gastric mucosa, and the adrenal glands. It's also been noted that there's infiltration of cytotoxic T cells in these active lesions, which shows that there's an immune response in the disease activity. Certain genes are also involved, such as PTPN22, NALP1, and certain HLA genes. And these are also functional components of the immune system, which links a genetic and autoimmune theory of pathogenesis. The clinical presentation of vitiligo, the onset of it can be quite sudden, but then there's usually slow and progressive expansion of white spots on the skin without symptoms. We call these patches or macules. There may be a history of autoimmune disease or a family history of vitiligo in the affected patient. There are various patterns of vitiligo. The first type is generalized bilaterally symmetrical macules on the face trunk and extremities, and that looks like this. We also have the segmental pattern, which is affecting one site or one side of the body. Acrofacial is a third type, affecting the lips, perioral areas of the hands and feet. Universal is the fourth type, which involves over 50% of the body surface area. And the fifth is a mixed type, which is a combination of all the previous ones I've mentioned. There are a few different types of treatment available, but it's always recommended to see a dermatologist for an exact and individual treatment plan. In terms of the treatment of vitiligo, the general idea of the treatment is immune suppression and stimulation of melanocytes to increase the production of the pigment to restore the skin color. One type of treatment method is using psoralen, which is a medication which increases your skin sensitivity to light, and then using ultraviolet light. This is one method of helping to repigment the skin. Topical corticosteroids like calcineurin inhibitors like pimecrolimus and tacrolimus creams, alongside vitamin D3, may help improve vitiligo by affecting the immune system locally and suppressing the immune system. There are certain risks involved if you are using light therapy, like some side effects can include itching and dry skin. There's also a slightly elevated risk of iatrogenic skin cancer because of excessive UV light doses. There is another type of UV called the eczema laser, which is a new form of narrow UVB treatment which is able to treat localized areas without affecting healthy skin. Increasing oral antioxidants like vitamin C and vitamin E may help to reduce the oxidative damage from free radicals which are present in the skin of lesions. And if a patient isn't responding to this, there are surgical techniques which can be used. So one method is skin grafting, which is often reserved for those who aren't responding to the medical therapies. Other methods can include cosmetic tattooing, which is limited to specific areas and it helps to repigment these macules.